If you've ever dealt with extremely itchy and flaky scalp that just won't budge, you may actually have a condition called scalp psoriasis. Hi everyone, my name is Dr. Jenny Liu. I'm a board certified dermatologist, and in today's video, I want to talk to you about what is scalp psoriasis, why it happens, what you can do at home with over-the-counter products and treatments, and when it is time to see a dermatologist. And if you enjoy educational skin and hair care content like today's video, I would love it if you can give this video a thumbs up and don't forget to subscribe to my channel. So what is scalp psoriasis? Before we talk about scalp psoriasis, maybe we should just talk about psoriasis as a whole, because scalp psoriasis essentially is just psoriasis but showing up on your scalp. Psoriasis is a chronic and inflammatory condition. So with that, there is no cure, but with the right treatments, it can be very well managed. And psoriasis is actually one of those conditions. To date, we have one of the most effective treatments out there, and there's a lot of variety of different treatments, but it is nevertheless a chronic inflammatory condition. And it predominantly affects the skin. It can also affect your hair, your scalp, as well as your nails. And about a quarter of patients will also have arthritis, inflammatory arthritis. We call that psoriatic arthritis. Now, there's been a lot of research into understanding psoriasis, and what we do know that now is that even though psoriasis predominantly manifests on your skin, it actually is associated with other internal health issues. In fact, individuals that have really widespread, severe, as well as poorly controlled psoriasis, they have a much higher risk of cardiovascular disease. In fact, psoriasis, it's an independent risk for having heart attacks, strokes. There is significant association with type 2 diabetes, metabolic syndrome, and obesity. Smoking has also been associated with severe psoriasis and really makes the treatment of psoriasis less effective, because going back again, smoking is very inflammatory. Psoriasis is an inflammatory condition. So essentially, what you see on the surface with psoriasis on the skin, you can kind of think about that happening inside your body, in your arteries, and other parts of your organs. And psoriasis has also been associated with other inflammatory conditions like inflammatory bowel disease. So although dermatologists and maybe rheumatologists are the two most common specialists that manage psoriasis, it is nevertheless really a condition that also needs to be addressed with a primary care provider, to making sure that just your overall health is maintained and checked on. Now, psoriasis, like eczema, does present with kind of this red flaky rash. It is similar to eczema in the sense it's chronic and there's no cure. And how we can tell the differences is in the presentation, how the rash looks, and also where it presents. And the classic presentation for psoriasis are kind of the external elbows, the knees, the lower back, the shin, sometimes the face, as well as the scalp. And sometimes it can be tricky and there could be overlap, especially with a condition called seborrheic dermatitis. In fact, often on the neck and above, so your face, your scalp, ears, and sometimes body folds, psoriasis and seborrheic dermatitis can have this overlap, where as dermatologists, we even call that SIBO psoriasis. But they usually look like well-demarcated inflammatory red rashes, so we really kind of can see where the rash stops and ends. Sometimes eczema, the border is a little bit more blurry, and the scale, the degree of flaking on the skin where the rash occurs, is a little bit thicker. We call that white flaky, even micaceous, like mica scale. And that's kind of how we can visually kind of discern psoriasis from eczema, aside from the location. And sometimes it can be really tricky, and especially in darker skin tones, psoriasis can have a little bit different presentation. And this is where, at the end of the day, if we're not sure, we gather more information from the patient, maybe their family history, or at the end of the day, we may need to do a biopsy. Now, I mentioned psoriasis predominantly affects the skin. It can also affect the scalp, but the other location is it can actually affect your nails. And you may notice what we call like little yellow dots under the nails called oil spots. There may be pitting. There may even be onycholysis, where the nail plate is separated from the nail bed. And sometimes it can cause really inflammation around the nail folds, and that actually increases your risk for arthritis just because of the proximity of the inflammation of your nail unit to your joints. Sometimes you can even present as what we call like sausage digits, where there's so much inflammation that the entire finger is red and puffy. And so in those situations, we definitely want to make sure the patient sees a rheumatologist to assess for any sort of joint involvement. There may even be additional imaging like x-rays. And there can be significant inflammation where the nail actually can mimic onychomycosis or toenail fungus, where the nail is thickened and crumbly and just does not look normal. So we call that nail dystrophy. So why does psoriasis occur? It's often multidisciplinary. So very similar to eczema, there's probably multiple things. Number one, genetics play a huge role. In fact, individuals with psoriasis will note a positive family history, usually in a first-degree relative, so mom, dad, or sibling with psoriasis. And then often there is a trigger. And it's not uncommon for people to kind of live a life that never had psoriasis or any sort of rashes, and then all of a sudden, bam, one day it kind of just shows up. And so that is kind of how we see psoriasis. And similarly to a lot of other inflammatory conditions, there is a trigger, and the trigger is different for everyone. It could be stress, it could be an illness, it could be a medication, and sometimes psoriasis have been commonly associated with certain infections like a group B strep infection. Certain medications like beta blockers and antipsychotic medications can be a trigger in those individuals that kind of have that genetic predisposition already, and then bam, it's kind of like that perfect storm. And then they start noticing psoriasis popping up on their skin, on their scalp, and other parts of their body. Additionally, a couple of things to note is that psoriasis, like eczema, like acne, sounds cliche, but stress definitely can trigger it, as well as flare up pre-existing psoriasis. And then also there is a condition called kebnerization, where psoriasis, as well as a few other skin conditions, will come and present in areas of previous injury. So for example, if you scratch yourself, you may notice that psoriasis will come in this linear scratch. Or say if you had surgery recently and there is a surgical scar, you may notice the psoriasis following along the pattern of your scar. That is called kebnerization, and that is something that happens with psoriasis. And often we see that it's helpful for us as dermatologists, as clinicians. It gives us clues because there's only a handful of conditions that kebnerizes, and definitely psoriasis is one of them. And the other thing I didn't mention is that smoking can be a trigger for psoriasis, and also definitely we know that smoking makes your psoriasis worse, and furthermore makes the treatment less effective because of the inflammation that smoking contributes. So going back to scalp psoriasis, you can certainly just have psoriasis in your scalp without having other body parts being affected. Most commonly though, people will notice psoriasis on their skin, but it's not uncommon for you to just present with scalp psoriasis, or maybe have scalp psoriasis and you may have that for some time and then start noticing psoriasis on your skin. It is also not uncommon. It's not as common, but definitely you can just have psoriasis affecting your nails, and certain people will have just joint involvement without skin involvement too. So those are less common. And then lastly, I forgot to mention, psoriasis can definitely affect your genitalia. And some people, obviously very similar to scalp psoriasis, they do notice rashes elsewhere on their body, but you can just have psoriasis of your genitalia. So when we see that, we definitely look for clues elsewhere on the body, but psoriasis, eczema, as well as lichen planus are kind of the three top conditions that we see affecting or can affect your private area as well. Now, as I mentioned earlier, when psoriasis does affect your scalp, it can have various different presentations, but the most common is that how it's a little bit different from dandruff is you can basically think of dandruff but on steroids, a little more extreme in the sense that there's more inflammation. Often the scale is a little bit more white, thick flakes versus sebderm. It tends to be a little bit more oily and the flakes are a little more yellow and greasy because sebderm is due to more sebum production. But like I said, there can often be an overlap and we call that psoriasis. Now, I am a lumper, I'm not a splitter, because to me, treatments are very much the same when it comes to sebderm and psoriasis. So I don't really go crazy having to biopsy and do all these expensive tests on my patients, knowing that the treatment is very similar. And often I don't really need to do a lot of invasive testing like biopsies to really figure out, because often patients will present with rashes on their body that will give me clues for the diagnosis. But I want you guys to understand that there is often no overlap between psoriasis and seborrheic dermatitis, which is why the treatments are very similar. Okay, so let's actually talk about treatment, starting with shampoos. Medicated prescription prescription shampoos I often will recommend and prescribe to patients. And there are a few that I actually will have my patients use on rotation to get the various benefits. Number one is just because of the inflammation and the buildup of thick scale, we really want a shampoo that has keratolytic properties, so helping to exfoliate, remove that dead skin buildup. And one of my absolute favorite is actually Neutrogena T-Cell shampoo with salicylic acid. And nowadays, if you actually can find their T-Gel, which has tar, coal tar, which is also great anti-inflammatory that really helps to cut down itching, I will often have them even rotate between the two. And the benefit here is, again, salicylic acid really helps to kind of dissolve that buildup of the white micaceous scale, remove that thickened scale, help to reduce inflammation. And this T-cell one has 3% salicylic acid, which is really great concentration. And so what I have people do, have my patients do, is just like use that a few times a week as they're washing their hair in replace of their normal shampoo. And this one is fairly gentle. I don't find it to be extremely drying on hair, but certainly if you do have dry hair and also have dandruff, this is where, going back to my older video, adding some oil, even conditioning your ends before you shampoo can be really helpful. Another shampoo that I really like that I will often have my patients alternate with the T-Cell is a ketoconazole or nizoral shampoo. If they want the prescription, I'll prescribe them 2%, otherwise 1% is over the counter. And here, again, it's kind of treating that overlap, right? That SIBO psoriasis overlap, but also ketoconazole and nizoral is anti-inflammatory. It does help to reduce inflammation and reduce that yeast burden that we do know is kind of higher because of the inflammation. So overall, it's just great at reducing the inflammation that we see with psoriasis. And if you have mild psoriasis or you think you kind of have that subderm overlap, you can definitely even try like CeraVe hydrating anti-dandruff shampoo with zinc parathione. That is definitely more hydrating. And I find that zinc is great on hair. It's more gentle on scalp, and it's great if you have dandruff. But for psoriasis, I don't find it to be as effective alone, but certainly it can be a great one to rotate between the other shampoos like I mentioned, including ketoconazole and the salicylic acid. Lastly, another great option is Head & Shoulders. They have a wide range of different 1% zinc parathione shampoos that I find to be a little more gentle on hair. Overall, I do find that zinc P shampoos, they're less drying on hair. They are not as effective for treating active psoriasis flares. So this is where, zinc P from Head & Shoulders or CeraVe, they're great for maintenance. And then when you have an active flare, this is where I would recommend using the T-Cell and nizoral shampoos more regularly. The other thing you can definitely consider is incorporating like a salicylic acid scalp exfoliant into your routine, like once or twice a week, in place of the salicylic acid shampoo, if that works better for you. You have to just be very careful because there is a delicate balance between overdoing with exfoliation and having that effective exfoliation to remove the flakes. Because, as I mentioned earlier, psoriasis arises, it comes in area of trauma. And that trauma, we automatically think of physical trauma, but it can be kind of chemical trauma in the sense your skin barrier gets damaged, and that inflammation can trigger more inflammation cascade that actually could flare your psoriasis. But here, yes, you can definitely incorporate like a scalp exfoliant with salicylic acid once or twice a week as tolerated. Ones I really like includes like Inculus has a great BHA cell acid scalp exfoliant. Briogeo also has a detox scalp spray that contains a blend of AHA and BHA. And then I know Kerastase does have a salicylic acid scalp serum that is a great leave-on treatment to kind of help and soothe, as well as more gently exfoliate the scalp and keep the scalp hydrated at the same time. And I believe that contains 1% cell acid. Now, even though I just listed so many products over the counter, it is so common for patients to come in and say, I have literally tried everything in drugstores under the sun, but my psoriasis is not going away. And that is kind of what we expect. I mean, conditions like psoriasis, seborrheic dermatitis, eczema, acne even, there are medical conditions. And even though we do have a handful of drugstore skincare medicated shampoos that can help jumpstart you while you're waiting for your dermatology appointment, or really meant for mild conditions that can be maybe managed with those. But in general, most people, when they do have really severe conditions, skincare or drugstore products are not going to be enough. Just like, when you have really severe high blood pressure and other things, you can't easily manage with just maybe controlling your diet. It's the same concept here. So if you've tried those over-the-counter treatments or you have really severe disease, this is the time to see a dermatologist. And as I mentioned earlier, severe psoriasis has been linked to really bad inflammation inside the body. So when you have very extensive psoriasis, widespread, that's not being controlled, think of that inflammation on your skin happening inside your body, inside your arteries. That in and of itself, as I mentioned, is a high risk for heart attack. So seeing a dermatologist, seeing a provider is so important, not just for your skin health, but also for your overall health. And I definitely have seen so many cases of psoriasis severe enough leading to hair loss. And so this is where treating your psoriasis appropriately is going to help with that. So what do we do when we do see a patient? Well, it really depends on the extensive nature and the severity, but if it's just localized on the scalp, most people usually do really well with a combination of the things I mentioned, like those medicated shampoos. On top of that, we'll add in a topical anti-inflammatory, namely steroid treatment in the form of a topical form. So there are a lot of different vehicles available. It just depends on the individual's preference and their grooming habits. But we can prescribe anything from oils to lotions to solutions that can easily apply to even ointments if they prefer, and often used like once or twice a day to all over or to the spot areas to help reduce the inflammation, the flaking, and the itching. There's also non-steroidal even creams like vitamin D analogs that help to normalize the skin turnover, because in part there's abnormal turnover because of the inflammation. And then when it's really bad, very inflammatory, and there's widespread disease, not just of the scalp, or if it's just really bad, poorly controlled, or hard to control, I should say, scalp conditions, where maybe the patient have failed the topical things, then we have a conversation about even oral medications, even injectable medications. Psoriasis is actually one condition that we actually have quite a few medications available compared to some of the other conditions. So it's definitely one dermatologic condition that has had quite a bit of extensive research. So that is the good news. And your dermatologist can definitely talk to you about the risks and benefits of each if it comes to it. Lastly, I just want to hit home some lifestyle tips and scalp care tips. So first of all, even though it's really itchy and flaky and you may have the inclination to pick, please try not to. And if you probably have noticed there's pinpoint bleeding. Medically, that's actually called Auschwitz sign, and it's actually a sign that we know how to distinguish between psoriasis and eczema. And that essentially, if you are traumatizing your scalp repeatedly, that can make it flare, going back to that capniarization phenomena. So you definitely want to be more gentle. You can certainly try some hydrating scalp serums or hydrating shampoos, but please don't aggressively scrub, rub, and pick at your scalp. You'll only make it worse. If it's itchy, use an anti-dandruff shampoo, use a cell acid or even tar shampoo, as I mentioned earlier. Those are actually great at helping with the inflammation and the itching. And then see your dermatologist when you're able to get on prescription medications. Topical steroids does help significantly with the itching. And you can even try hydrocortisone over the counter while you're waiting. It's not gonna be often strong enough, but certainly it's better than doing nothing. And then, it's easier than said than done, but managing stress in lots of different ways, whatever makes sense for you. But we do know that stress leads more to cortisol, and cortisol triggers inflammation, and inflammation is really the root of psoriasis. And so cutting down on inflammation, stress management, eating a healthy diet, eating less inflammatory foods, and certainly if you do smoke, try to really cut down on the smoking, because as I mentioned, smoking not only is associated with more psoriasis, flares, more severe psoriasis, but also makes all the medicated treatments that we give you less effective. And then use more gentle hair care products, fragrance-free, less strong ones that could maybe, be irritating to your scalp. And so if you've been using products and it's working fine for you, that certainly, continue. But this is where you may want to actually stick to more fragrance-free hair care products, more hydrating products, ironically enough, even though there's a lot of flaking. And if you are doing those chemical exfoliants, as I mentioned earlier, just limit the use. I think 1 to 2 times a week at most is certainly enough. Alright guys, so that's all I have for you on scalp psoriasis. Let me know if you struggle with it and what products have worked well for you. If you have any questions, let me know in the comments below. I'll try to do my best answering them in a general way because I can't provide personal medical advice on social media here. But again, thank you so much for watching. Let me know what other medical topics you want me to talk about next, and I'll see you next time.